C'est bon, c'est bon, خلاص. So the next case is the upper digestive endoscopy. 66 years old woman with this picture here. So she had total gastrectomy 7 months ago, and now with dysphagia, the surgery was done for gastric cancer, and we have this stricture here in the site of the jejunal loop. So we go for our gastroscopy. We should find dilated esophagus as seen in the CT scan and MRCP. This is our esophagus, and you see the food coming here. So we'll suck everything slowly. So this is a sign of obstruction here. We see our loop here. So now we have to search where is our direction. We have going and coming loop. I want just to clean everything. So maybe we'll use a cap to help us. I don't see any structure here, but this is one loop. I will put some saline here. And this is a loop here. I see some structure here. I think this is a closed loop. Yes, this is a closed one. So I will come back and search for the other one. It should be just behind it here. I think just here. And this, I see some resistance here. And we see the inflammatory part here. And I could cross now. So we have a structure here. This is the ongoing loop, which is really clean. So I will come back to my we have sure structure here. This structure is beginning here. We see the infiltration of the mucosa here. I don't see any ulceration, but I'm sure it's an external compression. I will do some biopsy here, but I'm sure I won't find anything. I'm just pulling back my scope. أعطيني pince. So that's why we have all that vomiting. And you see, if I put the water, it will stay there. It won't progress. So we will do our biopsy. I don't think dilation will help. And you see, we have to put some pressure to go. Maybe a fully covered metallic stent will calibrate this structure. So I have just to measure. We can put the end of the stent here at 50 centimeter at least, or maximum. So my structure begin here. We are hotly 40. We are 42 centimeter. So we have to cover this part. and this here will be 45, 45, eh? And then the distal part of the stent, the middle part, and I have to come back slowly and see. In all case, I will put it in the esophagus, which will be, this is the stricture, which will be usually here, 35, 35 centimeter. So we have at least 7 centimeter stent, but I will prefer to put it here. So we will use maybe at least a 10 centimeter or 12 fully covered one, and fix it in the upper part. So I will cross again, and I see my resistance here. So we take some biopsy and we will discuss with the family, the oncologist and the surgeon for this option. Hello. So you take a biopsy. It's not sure to have something here. I will search for the شد لي هذه شوية ترى. hello. So we have to find a place where it's a little bit hard to take biopsy. Sakara. So here we have some resistance here, and we are using 8.9 millimeter scope. Hello. Sakara. Hello. Sakara. Hello. Sakara. So we can put a nasogastric tube for feeding. كي نحطو صوند لازم نثبتو تمشي لهنا طولو. I'm thinking about putting a nasogastric tube here. عندك صوند gastrique؟ مش عندك 18 c'est bon. So I will try to put a nasogastric tube. حل رقدها شوية. نخرج لك دقيقة خلينا نشوف الصوند داخلة ولا لا. زدت ما جاتش هنا. وين وصلت انت؟ لا تخشيت. اخرج. عاود امشي. باش ندز معاك. امشي برا. وخر شوية هذيلي تو نقول لك. امشي تو ترى شوي. مشيت هكا، مشيت سيبو برا. امشي برا، امشي 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 امشي. قداش وصلتوا؟ باهي ندز شوية زيت، خلينا نشوف وين مشيت. So we are putting nasogastric tube. اقعد هكاكا، خلينا نشوف وين مشيت. نورمال مش تمشي طول على خاطر الفيبروسكوب. لا امشي 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 برا بشوية. عندك بانسكور اترونجي نهد. امشي ديري، امشي هيك قاعد تقدم سي بون. استنى نهد. امشي برا دار سيب، امشي 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 برا، امشي امشي. قاعد تمشي انت؟ امشي امشي. لازمش تبوكلي لي. اقعد هكاكا. شوف وين مشيت ساعة. So I have to be sure that we are in the good direction. I think this is the closed one. هذه لا مسكرة. So this is the closed loop. So my nasogastric tube is in place. شو داير متأخرش هذيك هوا. So I'm sure we are in the right place. I will try to go in, but I think it will be impossible with the gastric tube there. شدها شوية، خلينا نشوف أنا لي ميزور نتاعي وين. شو تخرجليش ها. قاش وصلت انت غادي. ما به مش به، خلينا نجرب نخرج أنا شوية. أعطيه ماء، جيب لنا ماء سورانك كافاج. أنت شد 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 الصوم، شو تخرج هذيك هوا. So my tube is in place. I'm trying to get out without moving my tube. So we'll inject some water and go out slowly. My tube is sure in place. يتعمل بوكل. اجبد 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 زيد اجبد زيد اجبد 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 زيد 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 اجبد. سي بون به. هيك تو مستوية، تو وليت مستوية. تحت دقيقة خلينا نشوف. هكا مستوية ولات به. تو ندزوها تو. ليتو. شدها شدها شدها. به. So I'm sure my tube is in place now. قداش تو بالمزيغ. Très bien, parfait. C'est bon, parfait. Fixez-ha. شدها. So we'll give some water here. متر. فيكسيها بالكدا. هكا هو. نحبو بخوتيز. So we will discuss later if we do the stent. Just insert a nasogastric tube for feeding and we wait for the biopsy and decide should we put a stent. I think this only solution